Hello, everybody. Welcome to Module 2. To get started with this presentation lecture, I have this PowerPoint, and we're going to go over it called Optimizing Kidney Health Through Good Nutrition. And this is for your chronic kidney disease nutrition therapy class. Let's begin. Okay, so as an introduction to kidney health, according to the National Kidney Foundation, or NKF, around 35 million Americans live with some stage of kidney disease, and that's including end-stage renal disease throughout the year, which means that around 300 million Americans are living with properly functioning kidneys. Important to this, right, a balanced and healthy diet is imperative for maintaining good kidney function. Right, the kidneys over a period of a day, 24 hours, 7 days a week, they are responsible for filtering waste and excess fluids from the blood, and they also really kind of dive in and break apart, not really break apart, but definitely have a have a responsibility as far as processing the foods that we eat, and the foods that we eat can impact the ability of the kidneys to perform those tasks. Consuming the right nutrients supports good kidney function, while improper diet can hinder that, specifically table salt, excessive protein intake, excessive additives like phosphorus and potassium. They can all put a pretty big strain on the kidneys. And the strain that we see eventually comes out in a chronic manifestation known as chronic kidney disease. And eventually this worsening kidney disease can lead to other issues like high blood pressure, diabetes, all kinds of things. Vice versa, those things can also contribute to worsening kidney function. So let's move on. We mentioned briefly in the previous slide about how excessive sodium can impact kidney health, and here what I want to focus on is two roles of sodium, specifically the prevention and the management of how we perceive sodium and how it affects kidney health. So prevention-wise, sodium can control for fluid balance by affecting blood pressure levels. How does it do this? High sodium intake can lead to increased blood volume, leading to elevated blood pressure. Chronically elevated blood pressure does damage and impairs the filtering ability of the kidneys, and this kidney damage due to high blood pressure can worsen over time, which in turn accelerates kidney disease progression. Now, the management of that, excessive sodium causes the body to retain this fluid, right? So this leads to swelling, high blood pressure, and increased kidney workload. These kidneys, they must work harder to filter out all that excess fluid, which again can increase the kidney damage. So it's imperative that we reduce or limit the sodium intake to help reduce the incidence of swelling and high blood pressure. So in the previous slide, we said that we need to limit or restrict some of the sodium that we take in. And here are some recommended sodium intake guides. So the green, yellow, and red being it's okay to have recommended dietary allowance versus do we need to restrict, right? And so the green visual being no detectable level of kidney disease, you don't really have a whole lot of restriction that you need to really focus on because there's no kidney damage at that point, right? So the whole point about restricting or limiting is kind of just to meet those recommended dietary allowances, which is about 2,300 milligrams of sodium a day. Now, where it gets kind of iffy is in those levels of detectable kidney dysfunction, right? And so usually that's evidenced by decreasing glomerular filtration rates, right? So the yellow would be maybe there's a little bit of detectable kidney disease or dysfunction, right? And so we want to kind of focus on maybe reducing the intakes of sodium around 2,000 milligrams per day. And then the red would be something that we really kind of need to focus on with sodium because that's where sodium can really start impacting those comorbid conditions like heart failure like chronic obstructive pulmonary disease, like pitting and worsening edema, right? And so there we really need to focus on trying to get sodium intakes to less than about 1,500 milligrams a day, which is tough, but it is doable. So some strategies for reducing sodium intake, and this could be tough. This could be tough, but like I said in the previous slide, it is doable. And the reason I say it's tough is because average Americans, we tend to eat a lot of sodium. We tend to have a lot of it. Some of that comes from processed foods. Actually, quite a bit of it comes from processed foods. Nonetheless, though, around 3,300 milligrams for an average American per day in sodium. So what can we do to reduce that? Several examples below is what we can do to reduce it. So one is choose fresh, unprocessed foods over packaged and canned items, right? We can always try to limit the use of salt in cooking and at the table, right? So throw that salt shaker away. Another strategy we can employ is read food labels to identify high sodium products and eliminate those. If flavoring is an issue, we can always try to use things like herbs and spices. And then we could also add other seasonings, kind of like no salt, kind of like new salt, things that replace the sodium in that actual seasoning. But we get into iffy territory there because specifically with the no salt and the new salt, and those are available items in most grocery stores. They tend to replace the sodium with potassium. And so in those late stages of kidney disease, potassium is something that we actually want to try to manage as well. Okay, and so here on this slide we have a few other considerations for maintaining appropriate kidney health. Protein, potassium, and phosphorus, and then fluid intake. Specifically with protein, we want to make sure that we're getting optimal amounts, not necessarily excessive amounts. Right, and so we don't want to put too much of a protein load on the kidneys, and that can easily be done with excessive amounts of protein. So we just want to have a good balance there. Potassium and phosphorus specifically, they can, as far as additives go, right, they're very important because, well, they're very important with kidney health because they're filtered out by the kidneys, right? And so one of the things that potassium can do specifically in kidney health is if there's too much of a potassium load, a lot of times it's an electrolyte, so it can mess with certain certain processes of the body that need those electrical impulses. And phosphorus is kind of an iffy one because it has long-term implications regarding bone health. And then lastly, fluid intake. We want to make sure that our fluid intake is good, and we really want to avoid any kind of dehydration and overhydration. But dehydration tends to be the most damaging to kidney health in the long term. So we do want to make sure that we're at least getting good amounts of fluid a day. Okay, so conclusion time. Conclusions as far as kidney health, how to maintain it, what we can do to help manage it, right? As we've stated previously, proper nutrition, including sodium restriction, is critical in maintaining kidney health. And this is exceedingly important in a balanced diet that focuses on good nutrition because they help prevent that kidney damage that can creep up. Sodium restriction specifically reduces fluid buildup, and it helps control and lower blood pressure, especially in those chronic kidney disease patients. Making consistent dietary changes can have a significant impact on kidney function. So small changes like reducing sodium intake can definitely help, right? And so over time, these changes can slow the progression of kidney disease, and it can actually prevent you from getting any kind of kidney disease as well. Luckily, hopefully. And last but not least, always consult with a healthcare professional for any kind of personalized nutrition advice. There's so much more to these slides than what's actually presented in these slides. So when you can, dietitians are probably the best people to talk to about sodium intake and what your specific needs are. especially if you have any kind of issues with kidney health. And here we are at the last slide of the presentation, which is pretty much just a question or concern slide. So please reach out to me at the email above if you have any questions or concerns.